it's you again. My favorite new medical student. I hope we didn't put you off yesterday. Dr. Scalpel can be a bit intense, but he's actually pretty nice once you get to know him.
I heard that, Thumbs.
Oh, hello, Dr. Scalpel. I didn't see you there. Look, our medical student came back for day 2.
Good for you. Actually, today's a quiet day for our team. We don't have any operations scheduled, so we can take a few minutes to give you a little orientation of the OR. Would you like to do the honors, Thumbs?
Will do, sir. Okay, so... orientation. Let's talk about how the OR fits in with the rest of the hospital, okay? Great. Let's start from the very beginning. Let's say a patient gets sick and they decide to come into the hospital. Your family doctor might send them in, or they might come in right into emergency. The team of doctors and nurses in the hospital will work the patient up to figure out what's the matter with them. They might get admitted to a ward in the hospital for further treatment or investigation. After we have figured out what the problem is, it looks like the patient needs to have an operation to sort things out. This is where we come in. We might need to take something out, for example, or fix something, or open them up to see what's going on. The surgeon comes to see the patient and explain what's going to happen. They agree to have the surgery and give the consent to go ahead. We're all set for surgery, right? Let's go to the OR.
Not quite yet, Thumbs. Aren't you forgetting something?
Oh yes, of course. Just a temporary lapse, Dr. Scalpel. The slate is the big list of all the people who are having operations on a certain day. The patient's name might go on the emergency slate, which means their operation is urgent and has to happen soon. Or they might end up on the elective slate, which means the operation is more routine and can happen on the regular schedule. Does that make sense? Good, good. When the patient's name comes up on the slate, they are brought into the pre-operation holding area. We try to keep this area nice and quiet because patients are sometimes a bit anxious before surgery. Here, the patient meets the surgeon again, plus the rest of the team who will be taking care of them during the operation. When everything is ready, the team wheels the patient down the corridor to the operating room. Whee! Time to cut!
Okay, hold your horses, Thumbs. Let's not talk about the OR just yet. We'll be going there soon enough.
Sorry, sir. I seem to be getting ahead of myself.
Don't worry, Thumbs. What happens after the operation?
We come out of the OR and into a post-op area where the patient wakes up again. All the while, there will be members of the team monitoring the patient and helping them to wake up and start recovering.
Your operation is all over. Everything went great. You'll be feeling better soon.
The patient is usually feeling a bit sick or dizzy at this stage, and they can be in pain, so we keep them here for an hour or two until they're feeling better. Once you're ready, we wheel you in your bed back to your ward again so you can rest and relax and start to feel better again. Depending on what type of surgery we did, the patient might be able to go home the same day or the next day. If it was a bigger operation, they might need to stay on the ward for a few days more to recover.
What do we have to make sure we give them before we let them go, Thumbs?
We'll prescribe some painkillers and other medications for when they are back home. And we'll make sure the patient has a follow-up appointment with their surgeon, so we can check to make sure they're healing up okay.
Good work, Thumbs. And that's how the operating room fits in the work of the hospital. Stick around, and the next time, we'll go past the doors to the OR and explore what's in there. Now, it's time for coffee.